Did you know that nearly 70% of seniors in the US take at least one dietary supplement daily? And while supplements can be beneficial, combining the wrong ones can lead to serious health risks. In fact, some common supplement combinations could be putting your health in jeopardy, especially if you're taking prescription medications or already managing chronic conditions. Today, we're diving into the dangerous world of supplements, specifically, 7 combinations that seniors should never take together. These seemingly harmless pairings could actually harm your health, leading to things like excessive bleeding, organ damage, or worse. Whether you're looking to boost your bone health, support your heart, or manage a chronic condition, it's crucial to understand how certain supplements interact. We're going to uncover the hidden dangers behind these popular combinations, and help you stay safe as you navigate your supplement routine. So, if you're ready to learn how to avoid these dangerous mistakes, stick around, and let's dive right in. 1. Vitamin K and blood thinners. Let's kick things off with a big one, vitamin K and blood thinners. Now, many seniors are prescribed blood thinners, like warfarin, Coumadin, to prevent dangerous blood clots that could lead to strokes or heart attacks. These medications are life-saving, but they work by reducing the blood's ability to clot. So, you can imagine that any nutrient that affects clotting could cause issues when taken alongside blood thinners. Here's where vitamin K comes in. Vitamin K plays a crucial role in blood clotting. In fact, it helps your body produce the proteins needed to stop bleeding. This is where the danger lies. If you take too much vitamin K, especially from supplements, it can counteract the effects of blood thinners like warfarin. The real problem arises when seniors consume vitamin K-rich foods or supplements without considering their blood thinner regimen. For example, supplements like vitamin K2, or even certain greens like kale, spinach, or broccoli, can increase vitamin K levels in your body and reduce the effectiveness of your blood thinner. This doesn't mean you have to avoid these foods or supplements completely, but you need to be consistent. Your doctor will likely recommend monitoring your vitamin K intake and possibly adjusting your blood thinner dosage. Always talk to your doctor before adding vitamin K supplements to your routine. 2. Calcium and magnesium. Next up is a combination that's commonly used for bone health, calcium and magnesium. Both of these minerals are vital for seniors, especially for maintaining strong bones and preventing conditions like osteoporosis. But while they work together to support your bones, taking them at the same time in large doses can actually cause some issues. Here's the problem: calcium and magnesium compete for absorption in the digestive tract. If you take them together in high amounts, it can interfere with how well your body absorbs both minerals. Essentially, your body may end up absorbing less of each mineral, meaning you're not getting the full benefit of either. Calcium is needed for bone strength, but magnesium helps with the absorption of calcium and also plays a key role in maintaining normal muscle and nerve function. However, if they're both consumed in large doses at once, your body might struggle to efficiently absorb both. To avoid this issue, it's a good idea to space out your calcium and magnesium supplements. For example, you can take your calcium in the morning with breakfast and save the magnesium for later in the day, like with dinner or before bed. This ensures your body has time to absorb each mineral properly. 3. Iron and calcium. Now, let's talk about another important but tricky combination, iron and calcium. Both of these minerals are essential for good health, but when taken together, they can seriously interfere with each other's absorption, especially for seniors who may be dealing with issues like anemia or bone health. Iron is crucial for producing red blood cells and transporting oxygen throughout your body. It's especially important for seniors who may be dealing with fatigue or weakness due to low iron levels. On the other hand, calcium is necessary for strong bones and teeth, and it also plays a vital role in nerve function and muscle contraction. But here's the issue: when taken together in high doses, calcium can inhibit iron absorption. That means your body won't be able to effectively absorb the iron you're taking, which can result in iron deficiency over time. This is particularly problematic if you're trying to treat or prevent anemia with iron supplements, while also taking calcium for bone health. So, what's the solution? The key is timing. Instead of taking your iron and calcium supplements at the same time, try spacing them out throughout the day. For example, if you take calcium in the morning with breakfast, consider taking iron with lunch or dinner, giving your body time to absorb each mineral separately. It's also worth mentioning that certain foods, like dairy, coffee, or tea, can also interfere with iron absorption, so be mindful of your diet when you're supplementing with iron and calcium. 4. St. John's wort and antidepressants. Next on the list is a combination that can be particularly dangerous for seniors: St. John's wort and antidepressants. St. John's wort is a popular herbal supplement often used to help with mild depression and anxiety. It's been used for centuries as a natural remedy, and many people turn to it because they believe it's a safer alternative to prescription medications. However, if you're already taking prescription antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, or monoamine oxidase inhibitors, MAOIs, combining them with St. John's wort can lead to serious health risks, including a potentially life-threatening condition called serotonin syndrome. Serotonin syndrome occurs when there's an excess of serotonin in the brain. Serotonin is a neurotransmitter that helps regulate mood, but too much can cause a variety of dangerous symptoms, including agitation, rapid heart rate, high blood pressure, confusion, sweating, and in severe cases, seizures or even death. St. John's wort works by increasing serotonin levels in the brain, and when taken with prescription antidepressants that also boost serotonin, it can cause your serotonin levels to skyrocket. This creates a dangerous interaction that's best avoided. So, if you're considering St. John's wort as a treatment for depression, it's absolutely critical to consult with your doctor, especially if you're already on antidepressant medications. Your doctor can help you evaluate the risks and guide you towards safer alternatives. Remember, just because something is natural doesn't mean it's always safe, especially when mixed with prescription medications. Always keep your healthcare provider in the loop about everything you're taking, including herbal supplements. 5. Fish oil and blood thinners. Let's move on to another combination that seniors should be cautious about: fish oil and blood thinners. Fish oil is widely known for its heart health benefits. It's rich in omega-3 fatty acids, which help reduce inflammation, lower blood pressure, and support overall cardiovascular health. In fact, many seniors take fish oil supplements to help reduce the risk of heart disease, stroke, and other circulatory issues. But, when combined with blood thinners, like aspirin, warfarin, Coumadin, or other anticoagulants, fish oil can pose a potential risk. Why? Because fish oil has anticoagulant properties of its own. That means it can naturally help to thin your blood to prevent clotting, much like blood thinners do. When you take fish oil along with a prescription blood thinner, the combined effects can increase your risk of excessive bleeding or bruising. This is particularly dangerous if you experience a fall or injury, as it could be harder for your blood to clot and stop the bleeding quickly. It could also lead to more frequent nosebleeds, gums bleeding, or even internal bleeding, which can be life-threatening. So, what should you do if you take blood thinners and want to take fish oil? First, don't stop taking your blood thinner without talking to your doctor. And second, make sure to discuss the right dosage of fish oil with your healthcare provider. In some cases, they might recommend a lower dose or even suggest monitoring your blood more frequently to ensure it's not too thin. 6. Vitamin E in blood thinners. Now, let's talk about another combination that seniors should avoid: vitamin E in blood thinners. Vitamin E is a well-known antioxidant that's commonly used to promote heart health, protect cells from oxidative damage, and even support skin health. Many seniors use vitamin E supplements to boost their immune system or reduce the risk of chronic diseases. However, if you're already taking blood thinners, like warfarin, Coumadin, aspirin, or other anticoagulants, you need to be careful about adding vitamin E to your regimen. Why? Because vitamin E has anticoagulant effects, meaning it can also help thin your blood, although not as strongly as prescription medications. When you take vitamin E alongside blood thinners, it can enhance the blood thinning effect, increasing your risk of excessive bleeding. This is particularly concerning if you're undergoing surgery, dealing with an injury, or even experiencing everyday cuts and bruises. The bleeding may be harder to stop, and in some cases, it could be life-threatening. Additionally, higher doses of vitamin E, especially above 400 IU, international units, per day, can significantly interfere with the clotting ability of your blood, compounding the effects of your prescribed blood thinner. This is especially important for seniors who may already be at higher risk for falls, internal bleeding, or other complications. 7. Zinc and copper. Lastly, let's discuss zinc and copper, two essential minerals that work in balance within your body. Both of these minerals are vital for seniors, playing key roles in immune function, wound healing, and the production of red blood cells. However, when taken in large amounts or in improper ratios, they can interfere with each other's absorption and cause imbalances in your body. Zinc is known for boosting the immune system, helping your body fight off infections, and supporting cell growth and repair. Copper, on the other hand, is necessary for producing red blood cells, maintaining healthy nerves, and supporting the absorption of iron. Together, these minerals work in harmony to maintain a variety of bodily functions. However, here's the catch: when you take too much zinc for an extended period, it can interfere with copper absorption in the body. This can lead to a copper deficiency, which may result in symptoms such as fatigue, anemia, weakened immune function, and neurological issues like numbness and tingling in the hands and feet. The problem arises because zinc and copper share a similar absorption pathway in the digestive system. If there's too much zinc, it can block copper from being absorbed properly, leading to an imbalance. This is why it's crucial to maintain the right ratio of zinc to copper, especially if you're supplementing with high doses of zinc for a prolonged period. To avoid this imbalance, it's important to ensure that your zinc supplements don't exceed the recommended daily allowance, and if you're supplementing with zinc for a specific health condition, your doctor might recommend a copper supplement to keep both minerals in balance. So, there you have it, 7 dangerous supplement combinations you should never mix. Remember, just because a supplement is natural doesn't mean it's always safe, especially when combined with other supplements or medications. Always talk to your doctor or pharmacist before starting any new supplement, and be sure to keep them in the loop about everything you're taking. If you found this information helpful, give us a thumbs up and don't forget to subscribe for more health tips. And as always, leave a comment below if you have any questions or experiences you want to share. Stay healthy and take care.